For AARP Massachusetts. If you're curious about COVID-19 vaccines and boosters, we are here to get you some answers. Hopefully, this will be a good use of your time. As you know, there are signs of an uptick in the cases, and this time of year we are seeing surges. So, if you're on the fence about getting a booster shot, now's a good time to give some serious consideration to it. Joining us today, we are very fortunate to have Dr. Larry Madoff. He is the medical director of the Massachusetts Department of Public Health for Infectious Disease and Laboratory Sciences. Dr. Madoff is an academic infectious disease physician. He's been a leader in the state's COVID-19 response. Good afternoon, Dr. Madoff, and thank you so much for joining us.
Thanks for having me, Jess. I'm happy to be here.
Appreciate it. So we're going to get right to it. We've gotten quite a few questions from our members and others who have a lot to be worried about with this COVID virus and what we're doing now. So first question, one of our members wants to know, if someone has had 2 vaccines, why do they need the bivalent, and what is different about that?
So there's a couple of answers to that, Jess, and to the person who asked the question. The first is that the immunity fades over time. So if you got a vaccine some time ago, your immunity from that vaccine is starting to diminish. And it diminishes gradually over time. It doesn't go away completely, and that's a good thing. Our immune system has a good memory, and it remembers things from the past, so it can still respond. But the levels of antibody and the briskness of the immune response diminish over time. That's why you need boosters of a variety of vaccines. That's why you need a tetanus booster. That's why you need flu vaccines every year. In part is because the immunity fades over time. And that is definitely true of COVID vaccines, that the level of protection against COVID disease, against severe outcomes declines over time. The second reason is that the virus has changed, that viral evolution, we've all heard about variants, that's a form of evolution of the viruses. The viruses change over time. We've all heard about Omicron, and right now we're in the midst of an Omicron outbreak of COVID. That's been going on for almost a year now. We've been seeing almost exclusively Omicron and its subvariants. So over the summer, vaccine developers created a vaccine that includes both the original SARS-CoV-2 virus that we saw at the beginning of the outbreak, and it also includes the updated Omicron variants. And so the new vaccine is better tailored to create a response to the Omicron. Those are the variants that are circulating now. So getting the current vaccine will better protect you against what's out there now. This is similar to the situation with flu also. Every year, the flu vaccine is updated based on what the most current circulating strains are. And that's the idea behind the bivalent booster as well.
Speaking of the flu, one of our members wanted to know, should they get the COVID booster or vaccine at the same time as a flu shot, or is that not allowed or not recommended? Any insights there?
Sure. It is absolutely okay to get both vaccines at the same time, or any time in relation to each other, but at the same time is really convenient because you can go in and get both shots at once, protect yourself from both flu, which we're, by the way, seeing a tremendous surge of right now. We're seeing many, many flu cases. And so it's a great time to get a flu booster as well. And the COVID vaccine can be given at the same time. They're usually given one in each arm. As Dr. Ashish Jha from the White House said, that's why we have 2 arms. And so you can definitely get both vaccines at the same time, and it's a good idea. We know you'll probably get a sore arm, and you may have 2 sore arms, but that way you can get it all out of the way at once.
Great. Thank you for that answer. That's very helpful. We've had a lot of questions on that one. What about for folks who have had COVID? Some folks have had COVID and they said, I already got a vaccine. Do I need to get a booster? And if so, when? How long do I wait?
So that's a good question. And there's a couple of aspects to that answer. The first is that having COVID, just like getting the vaccine, gives you some protection against getting subsequent bouts of COVID. And getting the vaccine and COVID provides probably the best immunity, that what we call hybrid immunity, because you're getting immunity from both the vaccine and from your own experience with the virus. So those two things together provide great additional immunity to the virus. Now, you can get the COVID vaccine anytime as long as you've recovered from your bout with COVID. There's no, you should wait until you're not contagious anymore, about 10 days or so after getting COVID, so that you don't give COVID to anyone else in the process of getting vaccinated. But you can get that vaccine as soon as about around 10 days after your bout with COVID begins. The CDC has said that it would also be okay to wait up to 3 months. So to wait for 3 months after your bout with COVID to get a subsequent dose of vaccine. And that's to try to sort of optimize to get the best outcome from the combination, because the COVID itself, as I say, provides some immunity in the short run. You could wait 3 months and then get your COVID vaccine. And that would, the bivalent booster then, and that would extend your period of immunity longer.
Okay, so that's a lot to take in. Let me see if I got this right. So if you've gotten the COVID vaccine and you've also had the booster, do you then need to get the bivalent booster as well? Is that
Yes, that's true.
recommended?
Yes. Yep.
Okay.
There are. And so for many of us older people, that could be this could be your 5th dose of vaccine against COVID, the bivalent booster. And I really want to emphasize everyone should get the bivalent booster. That's your best protection against getting sick and against severe outcomes.
Do you think that we're going to have to continue to get boosters and similar to the way the flu shot is every year?
We don't know yet. So I'm a little hesitant to answer that. But my guess is that yes, we're going to require updated doses of COVID vaccines, perhaps every year, the same way we get flu vaccines. But the jury's still out on that. We don't know. For now, everyone should get the bivalent booster, and we'll see where we are as time goes by.
Okay, that's very helpful. How about for people who are still hesitant to get this? Is there something that you can share to help people who are hesitant to get a vaccine or booster?
Sure. COVID is still with us, unfortunately. As Jess said, we're seeing an upsurge right now here in Massachusetts and across the country, indeed around the world. We're seeing more and more cases. We're seeing increasing numbers of folks in the hospital from COVID. We're seeing deaths. We're continuing to see deaths every day from COVID. And how can you prevent that? The best thing you can do to prevent getting COVID, getting sick with COVID, getting very sick with COVID, and also from giving it to other people, the best thing that you can do is to get that bivalent booster. We know that it's very safe and that it continues to be effective. It doesn't prevent every case. There are breakthrough infections, but when those infections occur, they're less severe than without the vaccine. We know that the booster adds to protection that you may already have, either from previous vaccines or from disease. And so it's important to get it. The side effects are what we're used to at this point. You get a sore arm. Some people don't feel good for a day or so, but that's about the extent of it. There's no worse side effects from subsequent boosters, and there's no increased risk to subsequent boosters. So getting a booster is really the best thing you can do to protect yourself and those around you.
Excellent. Thank you. So as a reminder, I'm Jessica Costantino. I'm the Director of Advocacy for AARP, and we are so pleased to be joined by Dr. Larry Madoff, who is with the Massachusetts Department of Public Health, an expert here who has been leading on the COVID-19 response in the Commonwealth. And in Massachusetts, we know that we've had some people have been asking, how easy is it for you to get an appointment here in Massachusetts?
Right now, it's very easy. So vaccines are readily available from your provider, from your doctor's office, from your health plan, or in retail pharmacies throughout the state. There are also a number of clinics that are ongoing, and you can find those all through the DPH online site, which I'm going to look for, and maybe I'll try to put that in the chat or something.
That's okay. We'll put it up for folks on the AARP website, information about where to get additional information.
It's readily available. You should be able to get an appointment today.
Great. That's very good to hear. We've heard from some of our members who have a loved one who lives in a nursing home or a long-term care setting. And we know that the vaccine and booster is available to those who live in those types of settings. Can you share how, if you are the loved one, how would you go about helping that person in the nursing home or a residential setting of long-term care?
Our long-term care facilities in Massachusetts have been really on the forefront of getting their patients and their staff vaccinated against COVID because nursing homes were very hard hit in the early days of the pandemic, before there were vaccines, before there was effective therapy. Our nursing homes, so they've been very proactive in making sure that vaccines are available to their residents. If for some reason you have a loved one or a family member or anyone you know who's in a long-term care facility and they haven't gotten vaccinated, speak to the staff in that facility, and they can arrange for vaccination to occur, or talk to that person's healthcare provider, and they also can arrange for that to happen. And so I would definitely urge that to happen. If there's someone in a long-term care facility, they should get vaccinated.
Excellent. Thank you. What about for people with the other side of the spectrum, with kids? If you've got kids in your life, how can you make sure that you're staying safe with them? And if they haven't been vaccinated, but you have, any recommendations there?
Well, my first recommendation would be, if the kids haven't been vaccinated, get them vaccinated. There is vaccination now, including the bivalent boosters, that are now available for everyone over the age of 6 months. And so if your kids haven't been vaccinated, if you know kids who haven't been vaccinated, bring them to the pediatrician, or even if they're old enough, you can even bring them to CVS or to Walgreens or your retail pharmacy and get them vaccinated there. So COVID vaccinations are available for kids, and I would definitely recommend it. It's hard if your kid has COVID not to get it, and so that's really important. And I would definitely recommend that. You can try to, if you know that a family member has COVID or another respiratory viral infection, you can try to isolate from them in the home as much as possible. Keep them in their own room. Don't share space with them. Wear masks in the house, and they can wear masks if they're able. But the best protection is to get them vaccinated.
Okay, so some things that as an older person you can do, and some things for the people who have children that they can do as well. That's very helpful. Mm-hmm. We've heard a lot about people right now, in particular with the flu. How can you tell the difference between COVID and the flu?
So there are some differences. For example, COVID has been frequently associated with loss of taste and smell, and that's rarely seen with flu. Um, but to be honest, the symptoms overlap quite a bit. So fever, sore throat, cough, runny nose, body aches, all of those symptoms are common in both conditions. And the best way to tell them apart is with a test. And so, fortunately, home tests for COVID are readily available, and they're pretty reliable. If they may be negative at first, but they will often turn positive over a day or two. So, if you check yourself on a COVID test and it's negative, check it again in a day or two to double check that. Flu tests are a little bit harder to come by, but you can get them at most provider offices. And most healthcare facilities will have flu testing as well. Strep throat can look a little bit like COVID sometimes, with a fever and a sore throat. RSV infection that we're seeing a lot of, the respiratory syncytial virus infection that's been going around, part of the triple-demic that people have talked about, can also look a bit like COVID. So it's important to get tested because, and I want to mention this also, Jess, that there's therapy. There are treatments for both COVID and flu for people who need them. And those treatments are very effective at preventing severe outcomes. So if you have COVID and you're over the age of 50, if you have comorbid medical conditions, if you have other medical problems, heart, lung, kidney disease, immunosuppression, then you should strongly consider, you should talk to your doctor about getting Paxlovid, the treatment for COVID. It's a 5-day oral treatment that you can get free of charge and will prevent the severe complications of COVID. So it's really important. There's also treatments for influenza. And so if you have influenza and you have a positive test for influenza, if you're someone at high risk, you may be eligible to take one of the oral flu treatments as well. So it's important to know what you have. And if you have one of those things and you have complications that could lead to bad outcomes, you should get treated.
Thank you very much. That's a great reminder about those treatments that are out there. For people who are in the midst of the end of the year holiday season, should they be waiting? Someone mentioned, one of our members wanted to know, should I just wait and then as soon as the new year starts, get a vaccine or a booster?
Well, there's no time like the present, I would say. Why wait? We know that there's COVID with us right now, unfortunately, and that the time to get vaccinated is while you're thinking about it right now, right away. And so I would just urge everyone not to wait. I expect those vaccinations will be available after the first of the year also, but I would say there's no time like the present.
Good advice. Thank you so much. What about things that we can do individually? Any personal behavior changes that you can recommend?
Sure. I think one of the most important things that we can all do is to stay home when we're sick, right? If you feel yourself coming down with a cold or fever or other symptoms that could be COVID or could be the flu or could be RSV, whatever it is, if you're sick, stay home. Certainly stay away from vulnerable people who are older or immunocompromised or who could have bad complications of upper respiratory infection illnesses, viral illnesses like COVID. But just staying home and staying away from other people is really important. You may feel like you're essential at work or that you need to be there, but it would be better to stay home. You can wear a mask that protects others from, it's what we call source control, so that helps protect others around you from your infection. But better just to stay home and to stay away from other people while you're sick. Get tested, as I say. So if you're not sure about what it is, could this be an allergy? Could this be a cold? Or is this COVID? Get a COVID test or get a flu test. It's really important. maintaining distance from other people is helpful. Good ventilation in the home or elsewhere, being outdoors is better. I know that's hard to do this time of year and here in New England, but if you can, it's outdoors is safer. Those are just some of the things. Of course, cough into your sleeve or your elbow, as we say, and not into your hand. Wash your hands. Use good hand hygiene. All of these things are helpful. So there are definitely what we call interventions that can protect us and those around us from viral respiratory infections.
You've given us so many good tips. Thank you for all of those and reminders of the things we can do to help both with others and ourselves, of course. So one or two more questions for you. In Massachusetts, how are we faring by comparison? How is it? Are we
Well,
worse than others? We better?
So I'm proud of Massachusetts. Massachusetts is a leader in immunization in general and has been in the lead of COVID vaccinations as well. We're well ahead of most of the rest of the country. Typically only one or two states, and they're smaller states, are ahead of us in terms of vaccination, in terms of COVID vaccination. So we're really good. But there's a lot of room for improvement. And so at this point, about 50% of people who have had a COVID booster have had a second or third booster. And a smaller percentage have had the bivalent booster. So there's still room for improvement there, and there's still room. Our older population has done better in getting vaccinated with COVID vaccines than young adults and children. So there's more room for improvement in those groups.
Excellent. Glad to hear that. In terms of Massachusetts specific, I know at one point I saw that Massachusetts was offering gift cards if people attended a particular type of booster clinic. Is that still going on? And if so, where can people find out about that?
It is going on. It's so Massachusetts has focused on equity in immunizations, and so we have emphasized vaccination in some of our communities that were hardest hit by COVID and have traditionally had less access to vaccination and healthcare. We call these our vaccine equity communities. And in those 20 cities and towns, again, and the information on this is available on our website, you can go to one of our Get Boosted clinics and get a bivalent booster and get a $75 gift card. So we are offering those gift cards. Those are still out there right now. And again, that information is on the DPH website under our vaccination pages and our vaccine equity communities.
Excellent. Thank you so much for sharing that. We are so pleased that you were able to join us. Thank you so much for answering all of our questions and spending this time with us. As you know, AARP has nearly 38 million members across the nation, almost 800,000 here in the Commonwealth of Massachusetts, and we work to strengthen our community, and we advocate for what matters to our families: the health and security, the financial stability, and the personal fulfillment. If you would like more information about what we're doing at AARP, you can look at our website, which is aarp.org/MA. And also you can get more information about COVID vaccines and boosters and others. So a special thank you to Dr. Larry Madoff. Any final words from you?
No, I really appreciate the time to talk to folks here, and again, just urge everybody to stay up to date in their vaccinations and to stay healthy and enjoy the holidays.
Thank you so much. Best wishes to you as well. Thank you, everyone.